Third report of Committee A. I shall therefore give the floor to Madam Rapporteur, Dr. Walaipon, who will lead the report in question. Madam Rapporteur, you have the floor.
Thank you, Chair. Third report of Committee A. Committee A held its third, fourth, and fifth meetings on 24th and 25th May 2022, chaired by Dr. Hiroki Nakatangi from Japan, Dr. Mariam Abdul Richard from Trinidad Tobago, and Dr. Tama Gabunia from Georgia. It was decided to recommend to the 75th World Health Assembly the adoption of the attached two decisions and two resolutions relating to the following agenda item. Pillar 4, more effective and efficient WHO providing better support to countries. Item 13, sustainable financings, report of the working group. One decision entitled Sustainable Financing. Pillar 2, 1 billion more people better protected from health emergencies. Item 16, Public Health Emergency Preparedness and Response. 16.2, strengthening WHO preparedness for and response to health emergency. One decision, one resolution entitled Strengthening Health Emergency Preparedness and Response in Cities and Urban Settings. One resolution entitled Strengthening Clinical Trials to provide high-quality evidence on health interventions and to improve research quality and coordination. Thank you, Chair.
Thank you very much, Madam Rapporteur. Thank you very much, Madam Rapporteur. I understand that our committee is willing to adopt this report as laid out. Are there any objections? I see none. Therefore, the report is adopted. Thank you very much. Now we will take up the agenda item 16, Public Health Emergencies, Preparedness and Response. Under Pillar 2, 1 billion more people better protected from health emergencies. Grouping of sub-items, 6.1, the Independent Oversight and Advisory Committee for the World Health Organization Health Emergency Program, and 16.3, WHO's work in health emergencies. The relevant documents are A74/16, A74/10 Lib 1, and A74/47. Under sub-item 16.3, we will also consider the draft resolutions contained in conference papers A75/A/conf/6 and A75/A/conf/8. Excuse me, I will repeat. A75/8/conf/8. There is two conference papers, Conference Paper 6 and Conference Paper 8. Now I am coming to very important points to put forward the rule of the game of ordinary debates of today. I trust that white paper on this matter has been well received by member states. It outlines my proposed way forward to ensure a clear and ordinary consideration of these items, including the draft resolutions. This proposal has been the subject of extensive informal consultations. My understanding is that it has the full support of those most closely involved, as well as support of member states generally. These efforts and this support is greatly appreciated. Accordingly, as set out in the white paper, I propose as follows. I would open the floor for statements by member states on items 16.1 and 60.3. After all members wishing to speak on these items have taken the floor, we would consider the draft resolutions through two speakers to separate back-to-back roll call votes as follows. A roll call vote would first be conducted on the draft resolution contained in document A75/A/conf/6. Immediately after, another roll call vote would be conducted on the draft resolution contained in document A75/A/conf/8. It would be further understood that no amendments would be proposed to the text of either draft resolution, and no procedural motions or proposals would be moved during the consideration of the draft resolutions. Furthermore, I repeat all, member states could offer explanations of vote of no more than 3 minutes only after both votes have been completed. So that is the package of the rule of the game today. May I take it that my proposal is agreeable to the committee? This is what we are going to do today. Rule of the game, I said. May I take it that my proposal is agreed by the committee? I see no objection. Therefore, it is agreed. Thank you very much. Agreed. I would like to once again express my appreciation for the cooperation received in the efforts made to come to an agreed arrangement. As your chair, I count on your support in keeping this important and welcome decision. Now, permit me to address the speaking opportunities for member states for clarity as this morning. We will be discussing more than just these two conference papers with the two draft resolutions. We will also be hearing an important report of the IOAC, and there may be other matters under item 16.1 and 16.3 that delegations may wish to further address. Accordingly, in order to make sure that we allow time for fair consideration of all items, we should proceed as follows. We would first hear from the chair of the IOAC, Independent Oversight Advisory Committee for the WHO Health Emergency Program. Then, having heard the important IOAC report, I would open the floor for comments on any aspect of the issues under item 16.1 and 6.3, including course reactions to the IOAC report. As always, national statement on these items should not exceed 3 minutes. Group statements should not exceed 4 minutes. Again, I kindly remind delegations that I will be very strict about time limits. I would like to be fair for everyone. After these general comments on any aspect of items 16.1 and 6.3, we will return to the draft resolutions. Accordingly, at this time, there will be opportunity for statements addressing the two propose resolutions. So that is your second opportunity. In this second statement, we should proceed as follows. The floor first be given to Ukraine, who would speak on behalf of the co-sponsors on the draft resolution contained in document A75/A-conf/6 for maximum of 4 minutes. The floor would then be given to Russian Federation, who would speak on behalf of the co-sponsors of the draft resolutions contained in document A75/A/conf/8, also for maximum of 4 minutes. Then, floor would be open to any other member states wishing to speak. National statements should not exceed 3 minutes. Group statements should not exceed 4 minutes. After all member states wishing to speak on the draft resolutions have made their statements, the draft resolutions would then be considered through 2 separate back-to-back votes, in accordance with the decision we have just taken that was set out in the white paper. I will provide opportunity for observers, international organizations, and non-state actors in official relations, as well as the Secretariat, to speak after the explanation of both. Of course, delegations wishing to exercise the right of reply will have the opportunity to do so at the end of the day, as decided for this Assembly session. I thank the committee for their understanding for this matter of directing the discussion. Thank you again. I think I am clear enough. Therefore, I would like to proceed. First, as I said, I would like to invite the chair of Independent Oversight and Advisory Committee for the WHO Health Emergency Program, Dr. Felicity Harvey, to make some introductory remarks. Dr. Harvey, floor is yours.
Thank you, President, Mr. Chairman. Honourable Ministers, Excellencies, Heads of Delegation, Directors General and distinguished colleagues. I am honoured to present document A7516 to the World Health Assembly on behalf of the Independent Oversight and Advisory Committee for the WHO Health Emergencies Programme, IOAC. This is the 10th report of the committee, which reviews the annual progress of WHO's work in health emergencies. Since the WHO Health Emergencies Programme was established in 2016, IOAC has been providing independent scrutiny and oversight of WHO's work on outbreaks and emergencies within the terms of our mandate, guiding the activities of the WHO programme, advising the Director General and providing reports to Member States. As of the 15th of February 2022, WHO was responding to a total of 83 graded emergencies, of which 10 were graded at level 3. Since submitting our report, IOAC has also been briefed on the crisis in Ukraine, with high impact on health and WHO's work on health emergencies. The committee is deeply concerned by the ongoing attacks on healthcare personnel and facilities and their disastrous consequences. We commend the WHO for their close coordination with key stakeholders in Ukraine and the life-saving interventions that the organisation is providing across the country. The committee will continue to monitor this work closely. The committee reviewed documents and interviewed key WHO staff to develop the recommendations for this report. After drafting it, we continued to conduct interviews with WHO staff, external partners, to triangulate our findings. Based on the document review and the internal and external interviews, our report describes the progress of WHO's work in emergencies, including COVID-19, and also highlights persistent issues that the committee has observed since its establishment in 2016 that should be addressed as a matter of urgency. We would like to draw your attention to those persistent gaps that must be filled to enable the WHE programme to lead WHO's emergency work. First, roles and responsibilities in emergencies of the major offices, the accountability framework, and reporting lines of functions supporting emergency management. Through our assessment, we identified internal power dynamics as an obstacle to clarifying accountabilities and lines of authority between the WHE programme and the wider organisation, as well as between the three levels of the organisation. We recommend that the Global Policy Group review current delegations of authority and the accountability framework for emergencies management based on the one programme principle. Moreover, we recommend that regional emergency directors be recruited jointly by and have dual reporting lines to both the regional directors and the WHE programme executive director. Second, organisational structure and systems to support WHO's work on emergencies. The committee found that internal systems can be fragmented, ambiguous and duplicative. We reiterate that sexual exploitation, abuse and harassment SEAH investigations should be handled differently from internal oversight services IOS investigations or other types of misconduct. Also in regional offices, a focal person for supporting functions and systems with responsibility for scrutinising misconduct in the respective region should be appointed by the DG. Additionally, centralised functions supporting the WHE programme, such as human resources, security, resource mobilisation, etc., should develop key performance indicators to track their impact on WHO emergency operations, and the dual reporting lines to WHE programme managers and divisional heads should be formalised, also at regional level. Third, on human resources capacity and management to ensure the organisation is equipped and resourced to lead emergency responses. The committee is deeply concerned that although WHO country offices' performance has improved, they are still lacking the required human and financial resources to build and sustain capacity, particularly for emergency operations in fragile contexts. Vacant posts for WHO representatives and WHE programme staff in country must be filled. On a positive note, during the pandemic, we observed the value in having a health emergency programme embedded within WHO, playing a leading role in coordinating an organisational-wide response. We recommend maintaining and increasing the WHE programme's core capacities, including social scientists and gender equity experts. In the future, standard operating procedures, SOPs, for timely internal surge capacity would also help to leverage in-house expertise. Fourthly, on finance. The committee continues to observe a chronic shortage of flexible and sustainable financing in the WHE programme and the WHO's work on emergencies. And we wish to congratulate the Working Group on Sustainable Financing for their work and applaud Member States for approving the draft decision in Document A75-9. Increasing assessed contributions will have a transformative effect and strengthen the authority of WHO. However, we reiterate that the proportion of WHO core flexible funding to the WHE programme and for financing preparedness activities should be increased. Fifthly, on international health regulations and country preparedness. We found that investment for preparedness is chronically low at national and international levels and for the WHE programme, and we recognise the difficulties WHO faces raising funds to support countries with preparedness activities. We recommend that Member States agree on a targeted revision of the IHR, in particular for the risk assessment and a graded approach to fake declarations. And additionally, the committee urges Member States to consider adopting IHR compliance measures under a treaty, convention or instrument for pandemic preparedness and response. Sixthly, The committee recognises WHO's leadership role in the global response to COVID-19. This was reaffirmed through interviews with UN partners who shared positive comments on WHO's leadership. However, also noted was that there may be more opportunities available for leveraging UN and other partners to amplify messages on prevention, testing and treatment for COVID-19. We recommend that the Secretariat continue to provide technical guidance and support to Member States in close collaboration with partners. Also, we warmly welcome the establishment of new initiatives, such as the WHO Hub for Pandemic and Epidemic Intelligence in Berlin, the WHO BioHub system, and the Global Biomanufacturing Workforce Training Hub. Finally, the committee welcomes the paper put forward by the Director General on strengthening the global architecture for health emergency preparedness, response and resilience. We commend the Secretariat and Member States for the effort and extensive consultation process. IOAC believes that many of the biggest failings in the global response to COVID-19 are largely in domains beyond the mandate of WHO, particularly political challenges, and these must be reviewed. This suggests that the required reforms must likewise go beyond WHO's remit and look at the wider architecture. We recommend a strengthened WHO must be at the centre of the architecture, with strong links between governance and finance and rooted in the principles of equity, inclusivity and coherence. We believe that more specificity on how to empower and strengthen WHO within wider reforms is essential. Honourable Ministers, Excellencies, Heads of Delegation, distinguished colleagues, in conclusion, the committee has witnessed WHO become a more reliable and competent partner to governments, UN entities, health cluster members, NGOs and donors throughout the pandemic. WHO has maintained and strengthened its leadership position in global health emergencies throughout the COVID-19 pandemic. The committee wishes to underline the fact that the pandemic is not over. There is more work to do. We are deeply concerned by the discrepancy between well-proven measures to control COVID-19 and the actions taken by decision makers. The committee will continue to hold WHO accountable and to deliver on our mandate, and we welcome the introduction by the Director General's Office of the implementation tracker to monitor the progress of recommendations. But Member States and partners must play their part as well. Ensure that WHO is equipped with sustainable and flexible funding, as you have just agreed, and that WHO is granted the global authority to carry out its work effectively. We renew our commitment to continue delivering on our mandate and to support WHO to play a central role in the global health architecture for pandemic preparedness and response. In presenting this report, the committee would like to thank the WHE programme and WHO staff who are working tirelessly to promote health, keep the world safe and serve the vulnerable. But we also wish to pay tribute to the health workers and partners around the world working to bring the pandemic to an end, to those promoting health and providing care in humanitarian crises, and to those who have lost lives from COVID or other ongoing emergencies. On behalf of IOAC, Mr. President, I thank you.
Thank you very much, Dr. Harvey, for your remarks highlighting essential elements of your very important report. On behalf of the committee, we thank you. And through you, your membership, and also your able secretariat. Thank you very much. Now, I recognize that Director General is with us. Director General, would you like to take the floor?
Thank you, Chair. I thank the IOAC for its work over the past year, and since it was established in 2016. I know IOAC has been working hard to provide oversight and monitoring, and to offer advice on our work related to health emergencies, and to keep us on our toes. The current IOAC term is coming to an end, and we will be renewing it after the World Health Assembly for another 2 years, from 2022 to 2024. I offer my sincere thanks to the co-chairs, Dr. Felicity Harvey and Dr. Geeta Gupta, who are stepping down as co-chairs. Thank you so much, Felicity. Please accept my greatest respect and appreciation. Thank you so much again. And I offer a warm welcome to the new chair, Professor Walid Amar, who brings great insight into WHO and emergency work. Professor Amar will assume the position immediately after this assembly, and I would like you to welcome him. Shukran Jazilan, Professor, for accepting the challenge. I have also asked Dr. Samba Sow to join the IOAC. Dr. Sow has been serving as one of my special envoys on COVID-19 preparedness and response since February 2020, and is the former Minister of Health of Mali. And he is now the Director General of the Center for Vaccine Development in Mali. And I would really appreciate it again if you could welcome Dr. Samba Sow. This is a critical moment in history for global health emergencies, and I will look forward to continuing our close work with the IOAC. Thank you so much. Back to you, Chair.
Thank you very much, Director General. Now, we have heard from the chair of the IOAC. I will give the floor to the member states to make any general interventions of any aspect of item 60.1 and 60.3. I will remind once again that 2 conference papers, you have another opportunity to speak. Those who would like to speak, please show your placard. Please keep on showing the placard. Thank you. I took not few, so please put like this for the time being, and so that Secretariat is going to take notes. And in the middle, I think I will read out the number of delegates who wish to speak to make sure that no one is missing. So please keep a placard like this, okay? There are 3 initial speakers. First, Senegal, on behalf of member states of the African region, followed by Sudan, on behalf of Eastern Mediterranean regions, and France, on behalf of member states in European Union. Therefore, may I invite first Senegal, followed by Sudan and France, and each will speak 4 minutes. And the time will be strictly kept. Thank you very much. May I invite Senegal to start. Senegal, you have the floor.
Déclaration africaine.
African statement on the agenda item on public health emergencies, preparedness and response. On agenda item 16.1 and 16.3, Senegal is pleased to deliver the statement on behalf of the 47 member states of the African region on agenda items 16.1 and 16.3. The African region welcomes the report by the Independent Oversight and Advisory Committee the IOAC, presented by the Director General. We welcome the efforts made by WHO to respond to the pandemic, as well as over 81 graded emergencies for other conditions. We also thank the committee for conducting their oversight role diligently, resulting in recommendations as outlined in the IOAC report, and the confidence that they have expressed in WHO leading emergencies. The IOAC have presented a comprehensive report. The African region would like to highlight key strategic areas of importance to our region. The weaknesses in the pandemic preparedness and response is influenced principally by inadequate financing for emergency response program within WHO and member states. And the fact that disparities in the financial situation of states are not taken into account. We support the recommendation for sustainable flexible funding as agreed to by the Working Group on Sustainable Financing to ensure that WHO at all three levels of the organization is better equipped to assess member states when required. The African region fully supports a strong, deliberate, continued focus on equity, multilateralism and a strengthened WHO with a leading and coordinating role in the global health architecture on pandemic preparedness and response. The African region supports the recommendation of the IOAC, which affirms the need for the WHO to play a central role, as opposed to an intermediary one, on issues of public health emergencies of international concern. The African region further commends the role of WHO within health emergencies. Over the reference period covered by the Director General's report, WHO intervened in various emergency situations, 78% of which have occurred in the African region, in terms of acute global emergencies, and 59% for protected emergencies. The situation is owed at a time when many countries in the region are facing health challenges, in particular the rising birth of NCDs. The African region applauds the leadership of WHO in coordinating the international response to the COVID-19 pandemic. It notes with concern the gaps in the management of the pandemic, with an acute imbalance in terms of access to vaccines against COVID-19. Some member states being left behind, while others have a very high level of vaccination coverage. It is therefore imperative to remove obstacles to the local production of vaccines, as well as to ensure the transfer of effective technology and know-how. The African region notes the gaps identified in the implementation of IHR and reaffirms in this regard the more effective multisectoral, multidisciplinary and transnational collaboration on preparedness and response. In conclusion, the African region emphasizes the need to strengthen surveillance and response systems to prevent and respond to public health emergencies. It is also important to build strong and resilient health systems that can provide essential health care and ensure continuity of care services during health emergencies. Thank you for your attention.
Thank you, Senegal. Next speaker is Sudan, followed by France, and then Brazil. Sudan, you have the floor.
Thank you, Mr. Chairman. Mr. Chair, Your Excellencies, Director General, the member states of the Eastern Mediterranean region acknowledge the efforts involved in compiling the reports presented today, including that of the Independent Oversight Advisory Committee. The observation and recommendations made underscore persistent gaps in our collective capacities to prevent, prepare for, detect, and respond to health threats. The COVID-19 pandemic has dominated much of the past 2.5 years, and rightly so. But other emergency needs and risks are also soaring in the context of climate change, conflict, and the increasing frequency and severity of natural disasters. Over 292 million people need humanitarian assistance worldwide, representing an astonishing 74% increase since January 2020. The Eastern Mediterranean region is perhaps the most severely affected of any WHO region. 12 of our 22 members have more forms of ongoing conflict. 35% of the humanitarian burden is within our region. We witnessed 5 of the world's 10 largest natural disasters in 2021. 26 of 28 major outbreaks occurred in fragile settings, and food insecurity and malnutrition are rapidly expanding. In this context, we welcome the report's recommendations, especially those pertaining to strengthening emergency workforce capacity, steadfastly applying lessons learned from the COVID-19 pandemic, and ensuring predictable, sustainable investment in preparedness. We note the recommendations related to WHO role in governing the response to future pandemic and support the central role WHO must play within the global health architecture. As COVID-19 has reinforced, solidarity is the way forward, and we subscribe to a more collaborative, systemic, and transparent approach to managing health emergencies. However, pandemics do not have a blanket impact worldwide. Differing country contexts call for tailored response. We therefore call on WHO to help strengthen national emergency management capacities, including developing guidance for member state equivalents of the emergency response framework. We are encouraged by recent initiatives, including the WHO BioHub system and the WHO Hub for Pandemic and Epidemic Intelligence, which not only provide a platform for multilateralism and global interconnectedness, but also promote mutual accountability and trust. In the same vein, we applaud the work of the Tripartite Plus on mainstreaming the One Health approach to detect and prevent zoonotic threats. While success has been noted in response to COVID-19 and other emergencies, we still face numerous obstacles. Unless these challenges are tackled through the principles of solidarity and equity, we will continue to fall short of our shared pursuit, saving life and guaranteeing human dignity. Thank you.
Thank you very much. Next speaker is France.
Merci, Monsieur le Président.
Thank you, Chairman. Director General, Rapporteur, dear colleagues. And I have the honor of speaking on behalf of the European Union, its member states, the Republic of North Macedonia, Montenegro and Albania, Bosnia-Herzegovina, and the Republic of Moldova, who also associate themselves with this statement. We'd like to take this opportunity to thank all of the staff involved in implementing the emergencies program for their efforts. Your workload has been very, very heavy, because not only have you had to respond to the COVID-19 pandemic, but you've also had to respond to more than 80 variable emergencies in all regions of the world. And the European Union expresses its full support for the staff at the three levels of the organization. In emergencies, this is operational importance to the WHO, and it plays a very key role for solidarity for the world and to ensure the legitimacy of the organization. Chairman, wars and conflicts always have direct and indirect negative consequences on the health of the people affected, both mentally and physically, and forced displacement, lack of access to food, lack of protection, restrictions on movement and attacks on healthcare facilities, and a lack of response of humanitarian and international humanitarian law continue to make the situation worse. And we believe that WHO should continue to play a role in monitoring and reporting on attacks on healthcare facilities and healthcare workers. We'd also like to underscore the importance of mental health of workers in crises, and it's important to have safe working conditions for healthcare workers. We welcome the implementation and mainstreaming of policies to combat sexual exploitation, abuse and harassment in all of the WHO's activities, and in particular in emergency contexts. We support the call of the IOAC to implement urgently the recommendations issued last year designed to mainstream security management and the prevention of sexual exploitation, abuse and harassment in a new unified framework, clarifying the roles and responsibilities of everybody in headquarters, in regional offices and in country offices is vital to develop a culture of zero tolerance for abuse. And once again, the European Union wishes to underscore its approach, which is one of zero tolerance of all forms of misconduct. We take note of the 10th report of the IOAC, and we encourage the management teams at WHO to accelerate the implementation of all of their recommendations. And as the report says, the only way of WHO becoming a leader in responding to emergencies is to work collectively with a solid management team with shared responsibilities in a culture of mutual trust. And for WHO to play that very important role, it needs more human and financial resources, and we urge member states to step up their financial contributions to the contingency fund for emergencies. Director General, we are grateful for the report on the emergency situation in Ukraine and the international risks linked to that, and the response that's being made. It's a remarkable effort on the part of these teams in very precarious and difficult situations. Thank you very much indeed. The Ukrainian healthcare system faces numerous challenges with serious consequences for mental and children's health, for people touched by infectious diseases such as HIV, AIDS, and the mental health of children, and for dealing with NCDs, particularly for the elderly. The aggression is making it more likely for transmissible diseases to spread, and the risk of sexual violence is also exacerbated, and the risk of food insecurity and indeed chemical and nuclear disasters. The EU and its 27 member states strongly condemn the fact that a permanent member of the UN Security Council and a member of the WHO Executive Board is clearly violating the basic principles of the UN Charter and the WHO Constitution. To protect peace, security and health in the region, we call upon Russia to stop immediately its war of aggression in Ukraine, including attacks on healthcare facilities, and to respect its responsibilities under international law.
The exceeding time, please. Thank you very much. Thank you for, please accept my apologies, but we are following exact rules applied for everybody. I'm sorry for that. I have 24 more speakers on the list. I would like to make sure at this time that no one who would like to speak left. I lead the list of the speakers: Brazil, Poland, Portugal, Philippines, Thailand, Australia, Belarus, Uruguay, Ukraine, Bangladesh, Russian Federation, United Kingdom, Kyrgyzstan, United States of America, Barbados, Islamic Republic of Iran, Canada, Ethiopia, Spain, China, India, Jamaica, Singapore, Indonesia, Republic of Korea, Argentina, Venezuela. So these are lists. Those who would like to speak, would you mind to come forward? That will be more straightforward. Would you mind to come forward to register to my secretariat?
Nicaragua.
I recognize Colombia and Nicaragua. Colombia and Nicaragua are added.
It's on the list.
Ethiopia is on the list. So those who are missing, please come forward.
And Germany.
Togo and Germany. Togo and Germany. Togo and Germany. So those are not listed and voiced. Please come forward within next 10 minutes. Then the list is closed. So you have 10 minutes. Let us start again. By following order: Brazil, Portugal, Brazil, Poland, Portugal, Philippines. This order. Brazil, you have the floor.
Thank you, Dr. Chair. Good morning, colleagues. We're going to speak on item 16.1, the report of the Independent Oversight and Advisory Committee for the WHO Health Emergencies Program. Brazil takes note of the recommendations and thanks the IOAC for the important work in these challenging times. As we recognize the qualities and relevance of conclusions and recommendations, we would like to comment on some specific topics. On para 33, on progress related to COVID-19 therapeutics, diagnostics, and vaccines for equitable access and the ACT Accelerator, the report seems to put excessive stress on the importance of regulatory aspects and do not highlight accordingly the difficulties that are presented by high prices, lack of room for negotiation, and other obstacles many countries face and continue to face in securing health countermeasures. On para 34, in the same sense, the report also looks imbalanced when it highlights especially the in-country bottlenecks as reasons for difficulties for delivery. Countries have strived in many occasions to meet demands, many of them excessive or unjustified. The nature of these demands should also be considered by the IOAC. On para 35, the report affirms that deadly variants emerged in under-resourced countries. What seems to be a controversial statement, for the appearance of new variants can occur anywhere. Given the limited time available for this intervention, and as we recognize and support the independent nature of the committee, we would like to further engage with the IOAC to better understand the rationale of some conclusions. Thank you.
Thank you very much. Next speaker is Poland, followed by Portugal. Poland, you have the floor.
Very much, Chair. Poland fully aligns with the statement made by France on behalf of the EU and its member states. First of all, let me take this opportunity to express my appreciation to the WHO work in health emergencies. Thank you for all your hard work and commitment. COVID-19 pandemic has not finished yet, and we have already another war just across our border. Let me say this loud and clear. Russian invasion on Ukraine is absolutely unjustified. Poland fully condemns the Russian Federation for its attack on Ukraine and its health infrastructure. Around 200 attacks have been carried out on the healthcare facilities in Ukraine since the beginning of the Russian invasion. This is unacceptable. We also condemn Russia's false narrative on this war and spreading misinformation. Let's be honest, what we are witnessing in Ukraine is genocide. Russian invasion on Ukraine is not only a violation of international law and rules of United Nations, including WHO. It has also a direct and severe impact on the public health in Ukraine. This war affects also neighboring countries. Almost 3.5 million of Ukrainian refugees came to Poland in the last 3 months. Every single Ukrainian refugee has been granted UHC on the same level as Polish citizens. So far, our health system is doing well in this extraordinary situation, but we could not do it alone. Big thanks to our partners from the EU for organizing a system of patients relocation, WHO and other organizations of the UN family for humanitarian aid, countless NGOs and individuals for ensuring the refugee with assistance and help they need. But providing an ongoing help is not everything. We also have to start thinking about recovery of health system in Ukraine. We must rebuild the destroyed infrastructure, deliver the equipment, and strengthen the medical health workforce. Let me finish with a declaration that Poland fully supports adoption of the draft resolution presented by Ukraine under point 16.3 of this agenda. We are also against Russian draft resolution under the same agenda item. This draft is only a cynical attempt to complicate our work and cause chaos in this assembly. This war must stop now. We demand that Russia immediately ceases its military actions in Ukraine and respects its responsibilities under international law. We also demand respect for international rules of humanitarian aid. I thank you.
Thank you very much. I would like to remind again that there is another opportunity to speak on conference paper 6 and 8. So after saying this, I would like to invite our next speaker, Portugal, followed by Philippines and Thailand. This order. Portugal, you have the floor.
Thank you, Mr. Chair. I have the honor to address the 75th World Health Assembly on behalf of Portugal in the item 16.3, and we align with the previous statement made by France on behalf of the European Union. Our hearts are with the people of Ukraine, suffering from a humanitarian and health emergency created by Russia's unprovoked and unjustified military aggression. As the past 2 years have shown, health emergencies not only appear unexpectedly, but also force upon us major challenges. This pandemic, as few health issues before, has dominated the global public health agenda and the global economy. Its political implications can be seen everywhere, as well as the impact in life and livelihood of the world population at most diverse levels. The onset of effective vaccines has therefore been a game changer, allowing the mitigation of economic, social and health consequences. Portugal considers the universal access to quality and affordable medical products is a fundamental element for the realization of human rights, namely the right to health and of universal health coverage. We would like to commend WHO's initiative ACT Accelerator as a good practice and underline our strong commitment to vaccine solidarity. Portugal is doing its share. We work with several countries in the international effort to fight COVID-19, including through the donation of vaccines and other necessary medical supplies. To date, we've delivered more than 6.8 million doses of COVID-19 vaccines to Lusophone and other countries, 17 in total, in all continents. In some countries, we're the biggest donor of vaccines, guaranteeing delivery and transportation. Considering only the African Portuguese-speaking countries, Portugal donations help these countries to have a higher vaccinations coverage against COVID-19 than its region average. Chair, the right to health transcends borders and ought to be upheld in emergencies, situations of instability and humanitarian crisis. Health emergencies widen inequalities and exacerbate social and economic inequities. Vulnerable communities, including refugees and migrants, are amongst the worst affected, including by the impact on access to health services and livelihoods. Good health, access to quality health services and continuity of care through all stages of migration, during and beyond health emergencies, is crucial for safe, orderly and regular migration. Portugal has designed policies and enacted legislation making the promotion of migrants and refugees' health one of its priorities, guided by an inclusive, non-discriminatory, holistic approach. Furthermore, Portugal is a proud supporter of WHO's Global Health and Migration Programme. We are committed with the ambition of making health systems more resilient, believing in the power of cooperation and inclusion of the most vulnerable. Thank you, Chair.
Thank you very much. Next speaker is Philippines, followed by Thailand and then Australia. Philippines, you have the floor.
Thank you, Chair. The Philippines thanks the Independent Oversight and Advisory Committee for the comprehensive report on the global response to the COVID-19 pandemic and the role of the WHO. We welcome recommendations on ensuring an integrated approach to health emergency management, not just in program implementation, but including strategies and approaches. We urge member states and the WHO to consider unifying different frameworks being used for global emergency preparedness and response to avoid fragmentation and duplication, and ensure ease of national adoption and implementation. The Philippines likewise welcomes recommendations to ensure that essential health care and social services are not hampered in times of emergency and conflict. These principles should be used not just for the current pandemic, but for all health emergencies brought about by conflict or climate change impact, such as natural disasters. The Philippines also welcomes recommendations to ensure responsiveness through flexible fund use at both global and local level, appropriately discussed in coordination with member states involved, and investments in interventions in all phases of disaster or emergency management. The current pandemic response has renewed the value and the leadership that the WHO plays in ensuring the health of all citizens of the world, and we support the further strengthening of the WHO Health Emergencies Program in fulfillment of its leadership role. I thank you.
Thank you very much. Next speaker is Thailand, followed by Australia and then Belarus. Thailand, you have the floor.
Thank you, Chair. Thailand welcomes the report and appreciates the WHO work on health emergencies and the work of IOAC that committed to improve member states' capacity to respond to health emergencies. We have three recommendations to IOAC. First, IOAC continues its mandate with WHE program and further recommend the critical essential issues that need to be addressed to other ongoing working groups, notably the INB, the WGPR, which will be transformed to the WGIHR, and the WGSF in order to ensure synergies and avoid duplication. Second, WHO should seriously consider the recommendations from IOAC and we request WHO DG Dr. Tedros to closely monitor the implementation of the recommendations through the established monitoring framework. Third, the Division for Preparedness under the WHE program should consider essential recommendations from IOAC, including that of prevention and response to sexual exploitation, assault, and harassment, to apply as a key element of UHPR. These will support the alignment between WHE program and member states' health emergency program. With regard to health emergencies, regional solidarity plays a key role. The CRF is a good example of collaboration within the region. Although the basis of effective health emergency response relies on resilient healthcare system in each country, rapid funding support at the initial phase of emergency is critical for immediate responses. Thank you, Chair.
Thank you very much. Next speaker is Australia, followed by Belarus, and then Malaysia. Australia, you have the floor.
Thank you, Chair. Australia recognises the central leadership of WHO in supporting member states in coordinating and responding to numerous severe, large-scale emergencies. While efforts continue to focus on dealing with the immediacy of the COVID-19 pandemic, we recognise and commend WHO's work to support a number of complex health emergencies, including in Ukraine. WHO's crucial role highlights the need for sustainable funding of the Health Emergencies Program at all levels, as well as contingency fund for emergency, as recommended by the Independent Oversight Advisory Committee. We appreciate the IOAC's report and strongly support action in response. We express our appreciation to the departing co-chairs for their leadership and welcome Professor Amar to take forward the work of the IOAC. Chair, this is an important report with clear recommendations that we encourage WHO and all member states to implement, particularly in respect to financing, the international health regulations and the WHO's role in the global health architecture. In particular, the WHO must be equipped with the necessary authority to coordinate pandemic prevention, preparedness and response, and member states must strengthen compliance and information sharing provisions under the IHR, as well as mechanisms to assess and develop preparedness capacities. We also echo the IOAC in emphasising that it is of paramount importance that WHO works together as one organisation across the three levels, with collective responsibility and shared accountability. WHO must also continue to prioritise the prevention of and response to sexual exploitation, abuse and harassment in all emergency responses. We appreciate WHO's sustained efforts to support member states strengthen their preparedness and response capacities as part of building resilient health systems. Chair, we cannot do these agenda items justice in the time we have today, and in closing we want to note our hope and expectation that the new Executive Board Standing Committee on Health Emergency Preparedness and Response will enable much more comprehensive member state engagement with the IOAC and support to the Health Emergencies Program. Thank you.
Thank you very much. About 10 minutes ago, I requested that those who like to take floor, please show the placard or come forward to the Secretariat. The added delegates on my list are Argentina, Venezuela, Germany, Togo, Colombia, Nicaragua. So if anyone is missing, please come forward. That will be straightforward. And Iran? I'm afraid. Please keep a placard high so that I think recognize. Jamaica.
But they are already in the list.
Jamaica is already on the list.
Yes. And so is Iran. Oh, yes.
Islamic Republic of Iran is on the list already. All right? So now, list is closed. Oh, very last minute. Can you recognize? Georgia. Now, list is closed. Finally closed. Thank you very much. So let us start again. So the following order: Belarus, followed by Malaysia, then Uruguay. Belarus, you have the floor.
Thank you, Mr. Chair. Distinguished colleagues, the Republic of Belarus highly appreciates the work of the WHO to respond to health emergencies. As mentioned in the presented report, we share WHO's concerns about the worsening humanitarian situation in Ukraine, as well as civilian casualties, destruction of social and economic infrastructure. The continuing conflict is leading to irreversible damage to the healthcare system and the health of the population. The government of Belarus supports WHO's efforts to provide assistance to the civilians of Ukraine, which are in a dire humanitarian situation, as within the country and beyond its borders. As mentioned previously at this assembly, our country is providing all necessary medical and other forms of assistance to persons arriving in Belarus from Ukraine. In this work, Belarus is cooperating closely with the UN organizations and agencies, as well as with the Belarusian Red Cross Society. Our border regions with Ukraine have established working groups to provide urgent humanitarian assistance to Ukrainian civilians who are in difficult living conditions. We have developed mechanisms for cooperation with interested agencies when it comes to registration and legalization of presence of these persons in Belarus, as well as providing them with employment and healthcare and humanitarian assistance in crossing the border into Belarus. We also are helping to settle Ukrainian citizens and helping them submit applications for asylum, providing them with refuge in Belarus. To provide employment to Ukrainian citizens, the Committee for Labor and Social Protection every week is drawing up a list of employers and provides information about vacant posts, as well as housing. In May of this year alone, 290 Ukrainians received Belarusian citizenship. Over the last 9 months, more than 3,500 Ukrainians received Belarusian citizenship. Given the procedures for examining these issues, we will not be going into the details of our decisions, but we would like to announce our co-authorship to the Russian draft resolution A75/A-Conf 8. Thank you.
Thank you very much. At this time, let me remind you that we are going to discuss conference paper 6 and 7 at different opportunities. And I am, if I look at this long list of requests of floors, that will be likely afternoon. That is what I understand, or my best guess, unless you are each one is speaking only 1 minute. I think it's not fair enough. So we will continue the same speaking slot for regional group statement 4 minutes and member states 3 minutes. We will continue like this. If we think about this, and also I would like to hear a response from IOC chair and from secretariat, and also we have requests from of NGOs and other international organizations. So my best guess, my very best guess is that afternoon you have opportunity to talk about 2 conference papers, and then voting will occur in the afternoon. I hope it's not midnight afternoon. So that is my best hope, wish. So this is, I'm wondering, I went too far, but I think that will perhaps too easy to understand what will go coming, right? So then, sorry to let you wait, Malaysia to take the floor, followed by Uruguay and Ukraine. Malaysia, you have the floor.
Thank you, Mr. Chair.
Malaysia takes note of the documents related to public health preparedness and response, and thanks to the Director General for the comprehensive World Health Organization report and recommendation on the public health preparedness and response, WHO's work in health emergencies. Malaysia concurs with the report and recommendations made by the Executive Board on the preparedness, response, and coordination activities at the global and country level for active Grade 3 emergencies. Malaysia has fully adopted the strategic preparedness and response plan outlined by WHO and established the National Strategic Plan for Preparedness and Response to the COVID-19 pandemic. In addition, we have actively participated in a series of online and physical meetings hosted by WHO at the ministerial and working levels. Aligning with the WHO incident management system, we have also fully adopted the emergency response framework for the COVID-19 pandemic. In Malaysia, the governance, policy, planning, and coordination for the COVID-19 pandemic was escalated to the highest level under a multi-sectoral collaboration of related ministries led by the National Security Council, directly under the purview of the Honorable Prime Minister of Malaysia. Mr. Chair, respected delegates, Malaysia has had a successful COVID-19 vaccination program, and to date, 97.6% of the adult population have been fully vaccinated, surpassing 80% target, very much ahead of schedule. We are also proud to inform that Malaysia developed and used an end-to-end digital COVID-19 surveillance and patient management system. For health emergency preparedness and readiness, Malaysia also acknowledges WHO's effort in expanding the monitoring and evaluation of the international health regulation capacities, and we are one of the countries that completed the joint external evaluation in 2019. Finally, Malaysia recognizes the continuous efforts and support from WHO to implement the International Health Regulation 2005 core capacities and assures compliance with the regulations. Thank you.
Thank you very much. Next speaker is Uruguay, followed by Ukraine, then Bangladesh. Uruguay, you have the floor.
Buenos días.
A very good morning, Chairman. The COVID-19 pandemic has revealed the weaknesses and inequities in preparedness and response to health emergencies at global level. And as document 16 and additional documents show, we need to ensure a balanced focus and a timely response to face pandemics, not only because this is a moral requirement and a requirement for public health, but also because we need to establish effective control and containment measures which reduce the scope of these health crises. Any crisis is also an opportunity, and we as a generation have an opportunity now to think very more carefully about WHO's response to this emergency. And I think we've all learned a lot, and everything that's been done to respond to COVID-19 needs to be taken into account as input for generating general instruments and processes for management and response that can be adjusted according to the particular outbreak. And we think that we should keep the IOAC, which makes a direct and indirect contribution to defining roles and responsibilities and helping the WHO to play a leadership and global leader role. And according to the report of the IOAC, recurrent problems have arisen since it was set up, and so that's why the report should maintain a key role in conversations around the response to COVID-19. Clearly, WHO has a central role in global health architecture with strengthened leadership, but also it needs to have the tools to enable it to sustain its plans, both regulatory and financially. In the IOAC report, we read that we need to strengthen financing for preparedness and response, but that also should include resources for the strengthened alert and warning systems to enable countries to strengthen their early warning and detection systems. And there we need also investment in research and development and IT tools, bearing in mind the progress that's been made in that area at a global level. We'd like to indicate our concern for communication-related issues, particularly risk communication, because we believe that is a key aspect in political and technical dialogue, and indeed it's key in order to help the populations around the world understand what is being done. And we need to have we need to have changes in the relations between humans and animals, because that has become clear in this particular COVID-19 outbreak. We've seen that some vital rights of humanity have been restricted, including the right to free movement. So we need to have equality in terms of access to information and education, because that has a key preventive role, because that's key to mitigate and prevent future pandemics and emerging diseases. We need to have a paradigm shift in terms of humanity's behavior in this respect. And finally, we must say that we need to generate alternatives for educational plans for health professionals who are involved in the response to pandemics.
Thank you very much. Next speaker is Ukraine, followed by Bangladesh, then Russian Federation. Ukraine, you have the floor.
Distinguished delegates, Russia's full-scale invasion of Ukraine since 24 February targeted a catastrophic health crisis in my country. It's already led to a massive loss of life, injured and trauma among innocent people. According to the UN, the human cost has already amounted 4,000 people being killed and 5,000 injured, among them several hundred children, with the actual figures to be believed considerably higher. Vulnerable people, women, children, elderly, people with disabilities bear to burn this health emergency. The Russia's deliberate shelling destructive life-saving health services, including treatment of chronic conditions and disrupted essential medicine supplies chains, severely restricting access to medicine. Russia invaders identify healthcare as an enemy. It's targeting hospitals, maternity, and other healthcare facilities, ambulances. Russia forces have destroyed more than 100 and damaged more than 500 healthcare facilities in 3 months. Mines and explosive devices continue to pose a threat to people's safety, leading to injuries, aiming and emotional distress. Living under constant shelling in a climate of fear has taken a toll on Ukrainian mental health. Target use of rape as a weapon of the war remains significantly underreported, leaving incredible mental scare of the victim. Extent and long-term impact of psychiatric morbidity and other forms of mental health problems are so huge they need additional assessment. By blocking grain export from Ukraine, which is one of the leading global grain producers, Russia exacerbates food security crisis, future jeopardizing health and nutrition throughout the world. Mr. Chair, this unprecedented health emergency crisis by the Russian aggression requires a firm and consolidating response from the international community. We are grateful to the World Health Organization, Regional Office for Europe, and Office in Ukraine for their efforts to respond to the health emergency in Ukraine targeted by Russia's war. To address the severe scope of the nature of the health emergencies in Ukraine, my country, together with a group of 48 WHO member states, initiated a draft resolution. Its objective to continue supporting the health sectors of Ukraine and refugee receiving and hosting countries to ensure that they remain functional and accessible to all who need assessment medical services. Your support for this resolution will be a significant contribution to the effective implementation of the WHO mandate to protect people and health emergencies. Thank you, Mr. Chair.
Thank you. Next speaker is Bangladesh, followed by Russian Federation, then United Kingdom. Bangladesh, you have the floor.
Thank you, Chair. Bangladesh appreciates the IOC for the comprehensive report and a wide range of recommendations. During the pandemic, the weaknesses of global health architecture and governance, as well as the challenges of the health systems, have come to the fore of discussion. So we flag that the recommendations of the report put forth the gravity of concern for which we need global solidarity and inclusive-based approach, enhanced support, assistance, and cooperation to strengthen the health systems of the countries should remain the cornerstone of our approach in securing the health for all. While we commend the recommendations, the paragraphs 33, 34, 46, and 48 draw our attention. Paragraph 33 that refers to a strengthening process for fairer allocation of vaccines, diagnostics, and therapeutics calls for business as usual approaches. In this regard, the calls made by the developing countries in various forums, including in the WGPR, is apparently missing. For example, the matter of equitable access to health emergency response tools could have been well reflected. Role of WHO could also be made clearer to support the countries, particularly the developing countries. Similarly, in paragraph 34, which calls for further financial support to ACTA, the requirements of the developing country could have been stressed. Restructuring of the governing structure of ACTA shall be done through a member state-led decision-making process, where in particular, adequate representation of the developing countries must be ensured. On the other hand, paragraphs like 46 and 48 incorporate IHR strengthening amendments and reforms of the Executive Board. Broader explanatory views would have been useful in better understanding of these paragraphs. We know our limitations and challenges in the context of health emergencies of international concern. Uneven impact leading to unequal recovery manifests that there is diverse need and concern for the member states. I thank you, Chair.
Thank you very much. Next speaker is Russian Federation, followed by United Kingdom and then United States of America. Russian Federation, you have the floor.
Уважаемый господин председатель.
Distinguished chair, distinguished colleagues, we note the importance of the report of the DG. It contains information about serious multifaceted problems with the Ukrainian healthcare system, including degradation of assistance to patients with communicable and non-communicable diseases, a rise in violence, and inability of children to receive routine vaccinations. All of this demonstrates the unsatisfactory condition of the Ukrainian healthcare system long before February 2022. The situation was complicated in 2014 when the aggression of Kiev against its own citizens in Donbass meant that Ukrainian troops killed and injured tens of thousands of civilians, including children. They damaged or destroyed hundreds of civilian buildings and works. These attacks and other atrocities are well documented. Many of them have been described in the current report. We understand the scale and duration of the crisis. Russia is therefore making serious efforts to restore the rights of the inhabitants of Donbass to health care. Starting in 2014, Russia has been sending more than 400 humanitarian convoys to Donetsk and Lugansk People's Republics and have provided more than 20,000 tons of humanitarian cargo, including 5,000 tons of medicine and medical equipment in the amount of over $300 million. Russia has helped Donbass restore medical institutions which currently are functioning normally and providing all forms of medical assistance. Russian medics are also working in zones with humanitarian crisis and are ensuring prevention of tuberculosis and HIV. Since the end of February of this year, Russia has taken in 1.5 million refugees, and since 2014, overall, Russia has provided refuge to 3.5 million Ukrainians who are provided with necessary medical and psychological assistance, including medication for long-term use. The children of refugees are in schools. University students are able to continue their professional training. Wounded Ukrainian soldiers also are receiving treatment and they're able to communicate with their families. We asked the Director General of the WHO to visit in person in order to learn about Russia's efforts to resolve the healthcare humanitarian crisis. Russia has always defended human rights, including those related to healthcare, and has rejected the politicization of issues under WHO's remit. For field doctors, ethnicity, beliefs, and native language of patients are irrelevant. The lofty goal of the WHO and all member states is to help countries provide the highest attainable level of health for all peoples of the world. This is the focus of our efforts. In this context, we believe it's important that resolutions on health emergencies ought to provide a comprehensive, practical humanitarian solution applicable to all regions of the world. Many countries have expressed their interest in this document and are expecting expert assistance from WHO. We believe that this approach ought to form the basis of all of our decisions today. Thank you.
Thank you very much. Next speaker is United Kingdom, followed by United States of America, and then Barbados. United Kingdom. You have the floor.
Tragically, the number of people affected by health emergencies globally is on a relentless upward trend, from Afghanistan to Yemen to Tigray, and of course in Ukraine. In all these countries, it is clear that the need for WHE is indisputable. The UK will speak to Ukraine later this morning, but I must recognise the important statement made by Ukraine just now, and I also must object to the gross misinformation set out just now by Russia in its comments on Ukraine, given the terrible human suffering caused by Russia's illegal and inhumane war. We are very grateful for the work of the IOAC under the leadership of Dr. Felicity Harvey and Geeta Rao Gupta, and the detailed report provided by the committee. Their independent expert insights are critical to strengthening the health emergencies programme. We welcome the recommendations provided by the IOAC, endorsing its view that WHE can and should be strengthened, and that this can be achieved with a focus on areas including alignment between the three levels of the organisation, enhanced risk oversight, and country-level staffing. Of course, this must be underpinned by reliable funding, and the UK endorses the increase in assessed contributions proposed by the Working Group on Sustainable Finance. And the UK is also proud to be WHO's largest contributor of core voluntary funding that WHO can assign to its own priorities. We reiterate the importance of strong, resilient health systems with integrated public health functions, including surveillance, to prepare for, prevent, and better withstand health emergencies. Also, the need for WHE to improve their coordination and collaboration with other WHO departments, including better understanding the barriers to recruitment and retention within WHO, and to continue to fast-track its work to prevent sexual exploitation and abuse, which must continue to be a top priority. It's now over 2 years since the COVID-19 pandemic began, and this Assembly should be a moment of reflection on the progress we have made. The intergovernmental negotiating body on a new instrument is now in full swing, and a plan is in place to amend the IHR to make them more agile and facilitate compliance. We must ensure our lesson learning translates into concrete action. Thank you.
Thank you. Thank you very much. Next speaker is the United States of America, followed by Barbados and then Islamic Republic of Iran. United States of America, you have the floor.
Thank you, Mr. Chair. The United States thanks the Independent Oversight Advisory Committee for their report on preparedness and response for public health emergencies. We appreciate their renewed commitment to continue monitoring and providing oversight of WHO's work on health emergencies and for supporting WHO's central role in the global health architecture in consultation with member states. We encourage WHO to take action on the committee's recommendations for improving accountability for emergency management, increasing the capacity and authority of the WHO Health Emergencies Program, and identifying available, predictable, and sustainable funding. The U.S. continues its efforts to end the acute phase of the pandemic and continues to support collaboration with WHO, member states, and all relevant stakeholders to advance efforts to build a global health architecture that's more sustainable and adaptable. The U.S. again stresses the importance of preventing and responding to sexual exploitation and abuse and harassment in humanitarian responses. We also recognize a significant increase in mental disorders worldwide during the COVID-19 pandemic and commend the WHO for its efforts to support technical programs to enhance mental health and psychosocial support in emergencies. Specifically, with regards to the COVID pandemic, we recognize that strengthening vaccine confidence and addressing the role of mis and disinformation in the decline of vaccine uptake and demand is critical to achieving our vaccination goals. And we remain committed to strengthening our efforts to address this growing problem and encourage member states to work together to combat declines in global vaccine confidence. We're also grateful for WHO's continued efforts to strengthen coordination with the wider humanitarian system. Additionally, we appreciate WHO's efforts to have strong surveillance and response systems in place for polio. With an expanded role for health emergencies and polio surveillance, and as part of the accelerated polio transition process, we encourage close collaboration with the Global Polio Eradication Initiative, immunization, vaccines, and biologicals, and other actors to ensure and sustain certification level surveillance for polio. So we're proud of our support to the health emergency programs and call on member states to join us in championing WHO's health emergency and humanitarian efforts in fragile, conflict-affected, and vulnerable settings at this World Health Assembly and beyond. Finally, we appreciate the statement by Ukraine and feel it's important to reject the lies and disinformation of the Russian Federation and look forward to more conversations on that topic this afternoon. Thank you very much.
Thank you very much. Next speaker is Barbados, followed by Islamic Republic of Iran, then Canada. I invite Barbados to take the floor.
Honorable Chair and distinguished delegates, the Government of Barbados congratulates the Secretariat on their continued work on public health emergencies, preparedness and response, and concurs that the COVID-19 pandemic has exposed shortcomings in the pandemic preparedness and response and a shortfall in health security and equity across the world. However, there have been numerous examples of global solidarity and collaboration and remarkable progress in research and development. Barbados will continue to support initiatives to improve preparedness and response to public health emergencies, including full implementation of the International Health Regulation, strengthening of human resources, and an integration of lessons learned from the COVID-19 pandemic. We welcome the IOC's guidance and request to Secretariat to work to close the gap with respect to defining roles and responsibilities in emergencies by major offices, accountability framework, and reporting line of functions supporting emergency management, enhancing organizational structure and systems to support WHO's work on emergencies, improving human resources capacity and management, increasing financing, especially to small island developing states with fragile health systems, promoting the tenets of international health regulations 205IR and country preparedness, advancing WHO's role in the global response to COVID-19 and future pandemics, planning for future global architecture for pandemic preparedness and response. The lessons learned must be translated into action and incorporated into updated national action plans to further strengthen health systems. PAHO has been instrumental in providing technical assistance, laboratory support and preparedness, staffing for surveillance and contact tracing, and personal protective equipment. Finally, Barbados will continue to explore further South-South cooperation agreements to boost our national public health responses. To date, we have had several kind donations and fostered agreements for staffing both in the medical, nursing, and laboratory technology fields. Thank you, Mr. President.
Thank you very much. Next speaker is Islamic Republic of Iran, followed by Canada, and then Ethiopia. Islamic Republic of Iran, you have the floor.
Thank you, Mr. Chair. We appreciate IOAC for organizing the report related to Agenda Item 16.1. Considering the COVID-19 pandemic impacts on health, economic, social, and security aspects, the pandemic demonstrated vulnerabilities and shortcomings in the national and international preparedness and response capacities. 3 pandemic years has reiterated how much important is the joint activities and concerted efforts between communicable diseases and health emergencies institute in different countries. For example, in the area of technical joint ventures and technology exchanges to manufacture medical countermeasures, especially sufficient vaccines, as the best preventive measure against the pandemic and other emerging and re-emerging diseases. We believe the WHO Hub for Pandemic and Epidemic Intelligence in Berlin is a good initiative and can assist WHO for a more effective management, monitoring, and coordination of the future public health emergencies of international concern and pandemics. One of the strategies that Islamic Republic of Iran has taken in order to translate the pandemic lessons learned into action is working around an integrated influenza pandemic preparedness plan and COVID-19 national preparedness and response plan through a national consultative workshop with WHO country office and WHO Eastern Mediterranean region and headquarters support. We think a graded approach to public health emergency of international concern declarations based on risk assessment could be worthwhile, but it needs a scientific-based approach by allocation sufficient work and consultations. With regard to member states' compliance with IHR amendments and implementation, this is a very delicate and sensitive area which need a lot of face-to-face elaborations and consultations. If such a process would proceed in an agile way, it might endanger WHO's spirit as a humanitarian and collaborative organization and transform its role into a supervisory security organization, which could be harmful for the organization in the coming years. Thank you, Mr. Chair.
Thank you very much. Next speaker is Canada, followed by Ethiopia, and then Spain. Canada, you have the floor.
Thank you, Chair. Canada commends WHO for its leadership and coordination efforts in responding to COVID-19 and ongoing crises and health emergencies around the world, including in Afghanistan, Democratic Republic of the Congo, Ethiopia, Nigeria, Somalia, South Sudan, Syrian Arab Republic, Yemen, and most recently in Ukraine. We thank the Independent Oversight and Advisory Committee for their report and welcome the recommendations to address persistent gaps related to emergency management, accountability, capacity, and financing. We note with interest the committee's recommendation to finalize and implement the new strategy for the Contingency Fund for Emergencies, replenishment mechanism, disbursement criteria, and operating processes. Canada is proud to be among the leading donors of the WHO Contingency Fund for Emergencies. We appreciate how rapidly the CFE can be mobilized and in response to a health response when time is of the essence, and we encourage member states to substantially finance this mechanism. Thank you.
Thank you very much, Canada. We now move to Ethiopia, followed by Spain.
Thank you, Chair. The Federal Democratic Republic of Ethiopia would like to note the report by the Independent Oversight and Advisory Committee that laid important recommendations for strengthening public health emergencies, preparedness and response. Ethiopia has made remarkable progress in the achievement targets set in the Health Sector Transformation Plan and global commitments. The COVID-19 pandemic has brought about important lessons to improved coordination, sense of urgency and local innovation. Currently, Ethiopia is also facing complex humanitarian emergencies that require even greater coordination, improved supply chain, increased financing and resources to ensure the continuity of essential health services. There's an ongoing work regarding the context-relevant implementation of sustainable and flexible funding at the government level, but this needs close support, alignment and collaboration with WHO and other stakeholders. Ethiopia would like to reiterate the need to avoid fragmentation across current initiatives and ensure smooth alignment of the WHO program among the different health system strengthening programs, especially the routine emergency care system that serves as a substrate for the larger public health emergencies. In alignment with the regional statement for Africa delivered by Senegal and South Africa, Ethiopia would like to emphasize on the recommendation for increased and sustainable financing for emergency response and bridging the transition to develop activities with increased investment in health system strengthening efforts to ensure resilience. We also highlight the need for an expedited procurement system and supply chain arrangements to ensure timely delivery of the required services. Taking the lessons learned from the COVID pandemic, we commend WHO's vision to strengthen the country offices and would like to call upon further strengthening on the implementation of the surveillance system for attacks. Ethiopia remains committed to enhancing a more comprehensive and agile system for emergency preparedness, readiness and response, and in providing meaningful contribution to facilitate the strive towards protecting people from health emergencies. I thank you.
Thank you, Ethiopia. I now hand the floor over to the delegate of Spain, followed by China. Thank you.
Gracias.
Thank you, Chair. Spain supports the statement made by France on behalf of the European Union and its member states, and we are grateful for the reports by WHO describing its work in health emergencies. Spain has participated very actively and with great interest in the process of studying, analysing and proposing conclusions within the working group on strengthening WHO preparedness and response to health emergencies. And Spain is convinced of the important leadership role that WHO should play in preparedness and response to public health emergencies. That's why we believe that we need to strengthen its governance so that it can be swifter and more efficient. We share the views expressed by a number of member states on amendments to the IHR, which are the best possible mechanism for implementing the recommendations that have come out of the various pandemic assessment panels and indeed from member states. Quite apart from amending the IHR or developing new instruments for prevention, preparedness and response to pandemics, we believe that we also need to improve preparedness and response through strengthening capacities at local level in a sustainable way. So that must also accompany this whole process. Spain recognizes that many of the lessons learned in the pandemic were already known of following previous emergencies, and yet no corrective measures were taken. So that's why we should underscore the need to ensure that these lessons become tangible actions to address the issues to ensure global public health security. Thank you.
Sorry. I would like to give floor to China, followed by India, and then Jamaica. China, you have the floor.
Thank you, President. We thank the evaluation carried out by the IOAC and the WHO's unremitting efforts to prepare for health emergencies, strengthen national emergency preparedness and response, and prevent pandemics and epidemics, and in rapid detection and response. We are of the view that WHO's work in health emergencies in 2021 is effective, especially the active and effective response to the Ebola outbreak in DRC and Guinea, and the support in response to complex emergencies across the world in the face of the global COVID-19 pandemic. WHO supports countries, especially vulnerable countries, and has made important contributions to suppressing transmission, reducing exposure, protecting vulnerable populations, and saving lives. We note that the report of the IOAC evaluated the existing issues in WHO health emergency management and response to the COVID-19 pandemic and lessons learned, and made recommendations. The IOAC rightly pointed out the discrepancy between well-proven measures to control COVID-19 and the actions taken by decision-makers in many countries to discontinue these measures while transmission remains widespread. And equity is imperative to ending this pandemic. We support these recommendations. We hope the Secretariat and the Director General will implement these recommendations and provide regular updates to members on implementation. At present, China puts its people and their lives above anything else. Our strategy is to avoid imported COVID cases and prevent the rebound of domestic cases. We have a zero COVID case policy. We adjust prevention and control measures according to the real situation and make plans for COVID control and ensure economic and social development. Major strategic achievements have been achieved, and it has been proved that China's control measures are scientific. We suggest that in the field of health emergency response, in view of different national conditions, policies, priorities, and capabilities, each member state's autonomy to adopt a differentiated prevention and control strategies should be respected. We should continue to adhere to scientific decision-making and professional honor in policy formulation and practice of public health or clinical diagnosis and treatment, and seek the health and well-being of the broadest group of people. Thank you.
Thank you very much. Next speaker is India, followed by Jamaica, and then Singapore. India, you have the floor.
Thank you. Thank you, Mr. Chair. India takes note of the IOAC report, which is pertinent in the wake of continuing COVID-19 pandemic and its socio-economic impact globally. Chair, India agrees with the health emergency program has suffered from chronic financial and staffing constraints, and the COVID-19 pandemic has highlighted that the health emergency program is inadequately equipped to deal with a global pandemic, while simultaneously responding to other health emergencies. IOAC has observed that during the first few months of COVID-19 outbreak, majority of countries failed to sufficiently implement the necessary public health measures such as early detection, contact tracing, isolation, and individual protective measures. We believe that it should also emphasize upon the need for unambiguous, direct, and timely risk communication by WHO as UN's chief coordinating agency in this regard. Delays in declaring public health emergency of international concern and pandemic by WHO and conflicting technical advices by technical experts at WHO had a direct bearing on actions taken by member states. We agree with IOAC's observation that Act A failed to provide the requisite results owing to shortfalls of political will and global solidarity, limited production capacity of vaccines, and insufficient financial investment. India feels that consensus building by WHO on this issue is a crucial unfinished agenda, as it perpetuates inequity in diagnostics, drugs, and vaccines, and needs to be addressed through a member states-led process on priority. India further agrees with IOAC that equity is imperative to end this pandemic and accordingly suggests that WHO should consider improving access through negotiated intellectual property rights waivers. India reiterates that vaccine inequity has brought to the fore the inevitable need to discuss and negotiate an access and benefit sharing framework for sharing of human pathogens of pandemic potential, including genetic sequence information, in a manner that also protects the rights of member states under the Convention on Biological Diversity and the Nagoya Protocol on Access and Benefit Sharing. These principles invariably need to be incorporated in letter and spirit in formative discussions of new initiatives like WHO BioHub. India would also like to suggest that while receiving financial support from non-state actors for health emergency prevention, preparedness and response, WHO should ensure that donor funds are not utilized for standard setting and normative purposes, strictly in accordance with the principles of FENSA. I thank you, Mr. Chair.
Thank you very much. Before giving floor to following delegates, I will have one small announcement. That is informal discussion with regards to Conference Paper 7 entitled Strengthening WHO Preparedness for and Response to Health Emergency, Proposal for Amendment to the International Health Regulation. The conversation has begun yesterday, and there is a lot of progress is coming. The meeting room is arranged. Room 24 is available from 12:30 at room 24. So all member states are welcome to participate. But please note that there will be no interpretation. The meetings start from, informal meetings start from 12:30 in room 24. Then we will come back to delegations' contribution. Next speaker is Jamaica, followed by Singapore, and then Indonesia. Jamaica, you have the floor.
Thank you, Chair. Hello, Chair, you hear me? Oh, Chair, Jamaica thanks the Independent Oversight and Advisory Committee for its detailed report. The concerns noted by the committee are replicated at the country level, and we agree that the lessons learned in the pandemic should be utilized to build resilience. Jamaica notes the value placed by the IOAC on having a structured health emergency program with adequate human and financial resources and the ability to scale up and down as required. Jamaica's own emergency program is coordinated at the national level and has an organization-wide network that was of great value in managing the pandemic. We'd like to recognize the tremendous value and work done by PAHO in building capacity for health emergency operation centers in Jamaica. Jamaica will embark on a primary healthcare reform this year that includes the building out of the structure of emergency disaster management at the regional and parish levels with dedicated staff and infrastructure. This will take us a step further in enhancing our preparedness and response capacities for all hazards. The concern for mental health and well-being of staff was brought home forcefully in the pandemic. The importance of including mental well-being for healthcare workers in any emergency response program is a necessity. Throughout the pandemic, Jamaica has had to institute various measures to tackle burnout and mental stress amongst healthcare workers. This includes therapeutic webinars for healthcare workers, a staff welfare program, and a collaboration with the private sector to provide counseling in hospitals. We look forward to the guidance to be provided by WHO in embedding staff mental health and well-being in the health emergencies program. The concern for incivility of social media towards science has been a major challenge in the pandemic and has had a major impact on vaccination rollout globally. Going forward in this new age, where non-traditional media is relied upon, especially by the age groups that are more difficult to reach for health messages, it is critical that the WHO provides early interventions and support to countries on effective communication to counter negative information. With the IOAC, Jamaica also recognized the significant progress that can be made with engaging with partners outside of health to strengthen external communications and to lead a unified response. Throughout the pandemic, the Ministry of Health and Wellness engaged with the private sector, NGOs, and civil society to enhance communication of key messages and reach into the population. In conclusion, Chair, Jamaica supports recommendations to improve the organization of the World Health Emergency Program and to provide additional resources to the program. WHO is indeed the global leader for health emergencies and as such should provide the best example for countries in allocation of resources for health priorities. And I thank you, Chair.
Thank you very much. Next speaker is Singapore, followed by Indonesia and then Republic of Korea. Singapore, you have the floor.
Thank you, Chair. Singapore would like to thank the IOAC for its report and contribute 3 points. First, the lack of clarity of roles and responsibilities, lines of reporting, as well as power dynamics throughout the WHO is concerning. This impacts performance negatively. We would recommend that the WHO focus on strengthening performance management as a key priority area. Establishing the right system to reward the right behaviors and persons is fundamental to organizational culture. Second, Singapore agrees with the IOAC that regional or intermediate PHEICs are not the right approach. The interconnectedness of the world today means that the pathogen of pandemic potential could spread to various parts of the globe within a matter of few days, regardless of origin. While we can see the benefits of a graded approach, for example, based on differing levels of uncertainty, such a framework should be kept as simple as possible. This would make clear what actions would need to be done and aid in public communications. Third, Singapore welcomes the establishment of the Standing Committee of Health Emergency Prevention, Preparedness and Response, which will better strengthen the communication and coordination between member states and the WHO Secretariat. Thank you.
Thank you very much. Next speaker is Indonesia, followed by Republic of Korea and then Argentina. Indonesia, you have the floor.
Thank you, Chair. We note the recommendations made by the IOAC on human resources, finance, WHR, country preparedness, WHO role in COVID-19 and future pandemic, as well as future global health architecture for pandemic preparedness and response. We appreciate the complementary nature of the IOAC report with the other recommendation put forward and discussed in various ongoing discussions on the global architecture for health emergency preparedness and response. We support the call to strengthening countries' commitment to prevent the spread of disease and public health risk factor between countries as set out in the International Health Regulation 2005. District or city areas, as part of the state, must have the capacity for prevention, early detection, and response to improve national preparedness and resilience for public health emergencies. In this regard, the IOAC recommendation needs to be translated into both concrete and concerted action. It is important that actions are not duplicative and fragmented at global, regional, and national level. WHO needs to ensure it is work together as one organization across the 3 levels with collective responsibility and shared accountability to assist member states. Finally, we commend the tireless work of WHO in addressing global health emergencies. We remain steadfast in our support of WHO current and future work and the need to make WHO more agile through, among others, a sustainable contingency fund for emergency as part of, and complement the ongoing global effort in strengthening global health resilience. Thank you, Chair.
Thank you very much. Next speaker is Republic of Korea, followed by Argentina and then Germany. Republic of Korea, you have the floor.
Thank you, Chair. The Republic of Korea welcomes the report submitted by the Independent Oversight and Advisory Committee, the IOAC, on public health emergencies and supports recommendations therein on major gaps. We also commend the IOAC for their comprehensive work. Korea thank you, Parting Chair Dr. Felicity, for her contribution and excellent leadership. We also welcome Dr. Ahmed, the coming chair. Korea will continue to work closely with the IOAC. We would like to highlight some points in the report which brought Korea's attention. Korea agrees that WHO has to play a leadership role in ensuring the equitable access to medical countermeasures. WHO has led several innovative initiatives such as WHO Hub System and ACT-A. Korea recently pledged to contribute additional $300 million USD to ACT-A from 2023 and commits to increase assessed contributions. As the hosting country of the WHO Global Biomanufacturing Workforce Training Hub, we will fully cooperate with the WHO to strengthen vaccine and biopharmaceutical manufacturing capacity of LMICs. My delegation fully supports the recommendation of the IOAC on international health regulations. Targeted amendment of the IHR should be timely, and we consider the work of IMB on a treaty, international convention, or instrument for pandemic preparedness and response, and working group on IHR is complementary. We also emphasize the support to the WHO is imperative for Secretary to continue supporting the capacity building of the countries to help them better comply with the IHR. And finally, the Republic of Korea supports IOAC recommendation on addressing misinformation. Misinformation and false narratives hinder agile public health strategies implementation. To achieve the global vaccination goal and prepare for the future pandemic, invest in risk communications is urgent priority. I thank you, Chair.
Thank you very much. Next speaker is Argentina, followed by Germany, and then Togo. Argentina, you have the floor.
Muchas gracias, señor.
Thank you, Chair. We wish to thank the IOAC for its report and recommendations. Argentina continues to support the central role of WHO in developing the governance structure for the global health architecture. At the same time, we'd like to share our concern about the possible fragmentation of current initiatives regarding the future of the global health architecture, regarding preparedness and response to pandemics. We underscore the importance of the World Health Emergencies Programme within the WHO, and particularly the key role it played during the COVID-19 pandemic. We are concerned by the creation of other initiatives or groups, including outside of the WHO, with mandates that may undermine the functions of the emergencies program. Regarding sustainable financing, we've already spoken on the issue in the PBAC and here at the Assembly, and we reiterate our commitment for the strengthening of WHO. We are fully prepared to continue working on and discussing various options to ensure sustainable financing, but we should remember the financial challenges faced by countries in our region, as well as the fact that they contribute both to the PAHO and to WHO. Finally, we join calls for an equitable approach to guarantee access and distribution of vaccines on the basis of the principles of solidarity and international cooperation. Thank you.
Thank you very much. Next speaker is Germany, followed by Togo, and then Colombia. Germany, you have the floor.
Thank you, Chair. Germany aligns itself with a statement delivered by France on behalf of the EU. The World Health Emergency Programme continues to be overstretched and understaffed. The IHR management with high level of short-term contracts is a concern and it must be adequately addressed. Given these circumstances, the programme does a great job despite occasional unacceptable derailments such as in the DRC. Unfortunately, this is often at the expense of the mental health and well-being of staff. The IOAC speaks of intolerable level of toxicity and incivility on social media towards science against WHO and its staff members, and we appreciate that the IAOC is drawing attention to this issue. Many of the problems result from the chronic underfunding. We fully agree with the IOAC that the solutions formulated by the Working Group on Sustainable Financing will be the single most important contribution to the improvement of the programme. Over the course of the 3 pandemic years, WHO has strengthened its leadership position in the global response. Not surprisingly, Germany believes that WHO should play a central role not only in the global health architecture for pandemic preparedness and response, but also in the discussions on this topic. And certainly this is also linked to a needed central role of the WHO in the new fifth that will be created. Against this background, we appreciate the DG's paper on this topic. Finally, we would like to wholeheartedly thank the 2 co-chairs for their outstanding leadership over the past years. I thank you.
Thank you very much. Next speaker is Togo, followed by Colombia and then Nicaragua. Togo, you have the floor.
Thank you, Mr. Chair. Togo supports the statement made by Senegal on behalf of member states of the African region. Togo has taken note of the conclusions of the Executive Board, which highlight the importance of strengthening the WHO Health Emergencies Program and the Contingency Fund for Emergencies. Despite the successful reforms begun in 2016 when it comes to emergencies, the COVID-19 pandemic highlighted weaknesses in preparation and response, as well as obstacles to health security for all. Healthcare systems were overwhelmed, and the implementation of the IHR of 2005 betrayed shortcomings. Togo, with the support of its partners, was able to manage various public health situations such as COVID-19, Lassa viral hemorrhagic fever, cholera, yellow fever, and measles, and prevent an explosive outbreak of cases or excessive strain on the healthcare system. However, there still are massive challenges to be addressed, including timely availability of financial resources, the availability of qualified healthcare staff, the compliance by communities with various public health measures, and the implementation of recovery plans, as well as the protection of health workers during health emergencies. Togo calls for global solidarity based on a spirit of equity so that the needs of populations can be met in accordance with the principles of human rights. Togo commends the important role played by the WHO and its actions to address health emergencies. Togo takes note of the report. Thank you, Mr. Chair.
Thank you very much. Next speaker is Colombia, followed by Nicaragua, and the last speaker, Georgia. Colombia, you have the floor.
Gracias, señor presidente.
Thank you, Chairman. I'd like to thank the IOAC for its report and for its recommendations, and we support the central role of WHO and its World Health Emergencies Programme in responding to complex emergencies. We would like to pay tribute to the Director General and thank him for his report on the work of WHO on health emergencies. We welcome the comprehensive data that's been provided for the prevention, preparedness and response to emergencies at a national, regional and international level. The information that's been provided draws attention to the importance of dealing with world health emergencies and strengthening global health architecture, and the need to continue to guarantee access to healthcare in the current crisis relating to the climate, COVID-19, and conflict. Colombia has promoted and adopted the relevant standards for the protection of health workers. We condemn any attack on health workers, and particularly those working in humanitarian situations, and we support the strengthening of measures that guarantee the safety of healthcare workers and humanitarian workers more generally. Chair, we thank the Director General for the updated report on the health situation in Ukraine. It's a matter of great concern that attacks on healthcare facilities continue, including those on hospitals and medical transport, healthcare workers, patients, and storage facilities. And once again, we condemn attacks on civilian populations that have led to more than 8,000 civilian victims, interruption of maternal care, led to an increase in the outbreak of communicable diseases, including COVID-19, measles, and others. And it's also exacerbated mental health problems and other health problems in the country. Thank you.
Thank you very much. Next speaker is Nicaragua and then Georgia. Nicaragua, you have the floor.
Muchas gracias.
Thank you very much, Chairman. And on behalf of the government and people of Nicaragua, we would like to thank the IOAC for its report. And as a developing country, we have witnessed the solidarity and international cooperation from Cuba, India, the Russian Federation, China. And I'd like to take this opportunity to reiterate our support for the principle of one China. All of this has helped Nicaragua ensure 90% vaccination coverage with over 5 million vaccines that have been provided successfully. We thank WHO, COVAX and Gavi and other initiatives that have helped us respond to emergencies such as COVID-19. We need to continue to avoid the politicization of WHO's work. The right to health is a human right. And to conclude, we recognize the work that's been done by the working groups and in particular the working group on sustainable financing, on strengthening WHO's response to emergencies. Thank you very much.
Thank you very much. The last speaker is Georgia. You have the floor.
And at the outset, let me express our full solidarity and support to Ukraine. We are gravely concerned over the ongoing health emergency in Ukraine, resulting in conflict-related casualties as well as increased risks of illness and deaths from non-communicable and infectious disease, gender-based violence, and of sexual and reproductive health, including maternal and child health deterioration. We stress the importance of ensuring respect for international humanitarian law, including protection of all medical personnel and humanitarian personnel exclusively engaged in medical duties. We appreciate the work and efforts of the WHO in this extremely difficult situation and pay tribute to those who lost their lives while trying to assist others. We underline the necessity of ensuring safe, rapid, and unhindered access to populations in need of assistance by the staff of the WHO on the ground and by all other medical and humanitarian personnel. As the co-sponsors of the resolution submitted by the Ukraine, we strongly support its goals. We reiterate Georgia's unwavering support to Ukraine's independence, sovereignty, and territorial integrity within its internationally recognized borders, including Crimea and Donbass, as well as for Ukraine's navigational rights in its territorial waters. I thank you, Mr. President.
Thank you very much. This concludes my list of delegation speakers. So let me explain what I am planning to do. This order, I will invite contribution from non-state actors, international organizations, and this is one slot, followed by response from chair of IOAC and secretariat. Then we will consider whether committee is going to agree the reports. So that is the work of this morning. I have about 45 minutes, and we will work hard to complete by lunchtime. So that is my objective. And at the end, before closing this morning session, I have a few announcements to make sure that everybody on the same page to go for afternoon session, which you have already decided a sort of method to do. So in other words, in my view, you have already taken non-stop train tickets. So I will make sure what does it mean. So that is the end of the day. And also I have a few announcements because that I will let you know. Then now I start inviting observers, international organizations, and non-state actors in official relations who wish to speak. In a conformity with Rule 47 of Rule of Procedures of the World Health Assembly concerning the representatives of United Nations and other intergovernmental organizations, I'm wondering whether UNFPA is willing to take the floor now. UNFPA, are you present and willing to speak?
They don't seem to be there.
I don't think UNFPA representative is not ready to speak. So I will go to inviting non-state actors in official relationship with WHO who wish to speak. First, may I invite the World Medical Association to speak.
Thank you, Mr. Chair. Honorable Chairperson, distinguished delegates, the COVID-19 pandemic has had devastating effects on societies with economic impacts that far outweigh those of previous pandemics. We are at even greater risk of emergencies due to environmental degradation, climate change, rapid urbanization, and increasing international travels, and the current geopolitical crises have also caused large waves of migration. To better protect the future, we need a global coordinated response system, mechanisms to ensure resilient healthcare systems offering UHC integrated within PHC care, a strong and well-supported health workforce, as well as harmonized health emergency preparedness and response systems at regional and international levels. The WMA, which represents 9 million physicians globally, supports the DG's white paper and highlights the importance of strengthening the WHO Health Emergencies Program and the Contingency Fund for Emergencies through sustainable financing. No one is safe until we are all safe. Thank you.
Thank you very much. You give us example of exactly 1 minute. Thank you very much. I will just read out those who applied to take the floor so that you can start immediately. International Federation of Medical Students Associations, the Save the Children Fund, International Baby Food Action Network, International Pharmaceutical Students Federation, Medicus Mundi International Network Health for All, Public Services International, International Union for Health Promotion and Education. I will call by this order. The next speaker is International Federation of Medical Students Associations. Floor is yours.
Thank you, Chair. Honorable Chairperson, distinguished delegates. The International Federation of Medical Students Associations recognizes the WHO and member states for placing adequate relevance into public health emergencies by working on an international instrument on pandemic prevention, preparedness, and response. We call upon the WHO and member states to put into practice the adopted resolution by completing the development and adoption of this WHO international instrument, while meaningfully involving the youth throughout the process, including implementation and follow-up through monitoring and evaluation. We are confident that we will be able to use the current momentum to lay the foundations for better pandemic preparedness and response by involving the relevant players, in which engaging youth is crucial. Thank you.
Thank you very much. Next speaker is the Save the Children Fund. You have the floor.
Conflicts and the climate crisis are disrupting the lives of children and their families at an unprecedented scale, jeopardizing progress towards the SDGs and deepening inequalities. Therefore, it is critical that all children, including those most impacted by inequality and discrimination, are protected and can access essential health services they need, even in emergencies. Save the Children calls on member states to ensure the continuity of all essential health and nutrition services and prioritise the protection of health and humanitarian personnel in emergencies. Strengthen mental health and psychosocial support, including dedicated financing needed to address pre-existing gaps and sustainably strengthen mental health in public health systems. Mobilise financial and technical resources to ensure equitable access to COVID-19 tools to reach the target of 70% of all countries vaccinated by the mid-2022. Thank you, Chair.
Thank you very much. Next speaker is International Baby Food Action Network. Floor is yours.
Breastfeeding is a resilient practice that provides food, care, immune support, and protection from the worst of emergency conditions. We must remember that breastfeeding prevents malnutrition in all its forms. Breastfeeding and conflicts of interest safeguards must be consistently integrated into all emergency prevention and management policies. As poverty rates, economic disparity, conflicts, hunger arising, short-term treatment models that rely on market-led approaches and fail to recognize how companies undermine health and the environment pose serious risks to child health. Ready-to-use therapeutic foods should not be on retail sale and should be used only in programs that promote skin-to-skin contact, relactation, and continuation of breastfeeding with appropriate transition to nutritious family food and psychosocial support. Micronutrient interventions should be culturally appropriate and not undermine sustainable food production, food security, and biodiversity. Thank you very much.
Thank you very much. Next speaker is International Pharmaceutical Students Federation. Floor is yours.
Honorable Chair, distinguished delegates, International Pharmaceutical Student Federation, representing over 500,000 pharmacy students worldwide, emphasizes the importance of strengthening response to health emergencies. With COVID-19 pandemic and recent health emergencies, healthcare systems around the world face major challenges in their preparedness and agility. IPS calls on the WHO and its member states to deploy healthcare trainees to their fullest potential, fighting against health emergencies. This includes granting students specific scope of practice within their profession tailored to their knowledge and experience. Specifically, this may include, but not limited to, preparing and administering vaccines, testing for disease screening, providing specific patient education and care activities. Furthermore, IPS urges WHO and its member states to recognize and support youth-led initiatives. Youth took on a major role of reserve health workforce during the pandemic, demonstrating immense passion and initiative in public health as future leaders of healthcare. Thank you.
Thank you very much. Medical Mundi International Network, Health for All. You are invited to speak.
Thank you, Chair. We support the IOAC's recommendation of fostering WHO's leadership role during public health emergencies. WHO's core budget must be significantly increased to ensure adequate running of emergency responses. We are concerned that the IOAC's position on the allocation mechanisms and Act A is inadequate. We urge WHO and member states to call for legally binding solutions and equitable access, and for reforming the Act A governance structure to make it inclusive of all member states, including developing countries. In paragraph 46, IOAC highlights the importance of strengthening IHR. We are concerned that its stance favors developed countries' views and ignores calls from developing countries and EV decision 150, item 3, to address equity issues in IHR. Finally, multi-stakeholder platforms.
Would you mind to conclude? You are exceeding time. Please conclude now.
What?
It's all right? You conclude.
Finally, multi-stakeholder platforms such as Act A have failed the test of equity.
Thank you very much. Next speaker is Public Service International. You have the floor.
Thank you, Chair. Health emergencies of existential proportions are emerging within a context of increasing zoonotic disease outbreaks, climate and ecological crisis, mass poverty, and wars. We urge WHO and the member states to, first, reform global health supply chains regionally and with national industrial policies that quicken emergency response. Second, fully implement international covenants and regulations which safeguard the physical and mental health of public emergency service workers. Third, adequately fund preparedness and response activities and sustainable fund of the WHO contingency fund of emergencies. Fourth, strengthen universal public health systems as the bulwark for preparedness and commit to do this in the emerging global architecture of health, emergency preparedness, response and resilience. Thank you.
Thank you very much. May I invite International Union for Health Promotion and Education? International Union for Health Promotion and Education. Are you ready to take the floor? Are you ready? Not here, it seems. It seems they are not here. We have received one recorded statement. So shall we, Secretary can display the video? Say the name from Federation. So the name of non-state actors who send us a recorded statement is Federation Handicap International, Humanity and Inclusion. I see there is some technical challenge, so we will come back when Secretariat is ready to display the video statement. Then I would like to go to the next stage. That is to invite responses from IOC Chair and Secretariat. First, I would like to invite Dr. Felicity Harvey, the Chair of Independent Oversight and Advisory Committee for the WHO Health Emergency Programs. If she would like to take the floor, please.
Thank you, Mr. Chairman. Honourable Ministers, Excellencies, Heads of Delegation, distinguished colleagues, IOAC is grateful to Member States for your insightful comments and the appreciation of our work, in particular from Senegal on behalf of the African region, Sudan on behalf of EMRO, France on behalf of the European region, Argentina, Australia, Bangladesh, China, Canada, Germany, India, Indonesia, Jamaica, Nicaragua, Philippines, Republic of Korea, Singapore, Thailand, Uruguay, United Kingdom, and United States of America. I thank Senegal for highlighting the key challenges in pandemic preparedness and response and on inadequate financing and disparities in the African region, and Sudan on behalf of EMRO for pointing out the increased frequency of national disasters and link to climate change. Our report noted a chronic shortage of flexible and sustainable financing in WHO's work on health emergencies. We are confident and hopeful that the Member States' decision to increase assessed contributions will have a transformational effect on this important area of work. We reiterate our recommendations for increasing investment for preparedness at national and international levels to support countries with preparedness activities. And we fully appreciate the comments from Australia, Thailand, United Kingdom and the United States of America and France on behalf of the EU on PRS-EAH. This is a key area of concern for us, and we will continue to monitor progress. We thank Malaysia, Singapore and Sudan on behalf of EMRO for empathising with the importance of the clear accountability framework in emergencies. This is of great importance to us. And we have duly noted the comments of Brazil with regard to the challenges and bottlenecks for access to medical countermeasures and delivery in countries, and we would be very happy to exchange views. IOAC reiterates equity is imperative to ending this pandemic. We also welcome Australia's comment on the new Standing Committee to the Executive Board, which will enable more Member States' engagement and the IOAC and support to the WHE programme. We're delighted to hear Member States' strong support for a strengthened WHO at the centre of the architecture, which should be based on the principles of equity, inclusivity and coherence, as many Member States highlighted. Member States' comments and recommendations on IHR, UHPR, the WHE programme, infodemic, misinformation, human resources were noted, and we will continue our monitoring of these areas. We thank all Member States for your support for our recommendations. This is really important to us, and we are very grateful for your support and trust. We reiterate our commitment to continuing delivering on our mandate and will work closely with the INB, WGPR, WGSF and other working groups. On a personal note, I wonder if I might take this opportunity to express my deep gratitude to Dr. Tedros, regional directors, Dr. Mike Ryan and Dr. Katerina Boehm for their confidence in me as the co-chair of IOAC, and the IOAC Secretary Munju Park for unstintingly supporting me to fulfil my role over the last 4 years. I also wish to add my sincere thanks to my co-chair and esteemed friend and colleague, Dr. Geeta Ragupta. May I thank you.
Thank you very much, Dr. Harvey. Much appreciated. And with regards to video statement, I said earlier, instead of sending a video statement, Federation Handicap International representative made a special journey to come here to present himself or herself. So may I invite Federation Handicap International Humanity and Inclusion to deliver statements. Floor is yours.
Thank you. Rehabilitation is a core element of emergency response. Early rehabilitation prevents or reduces complications, speeds hospital discharge, promotes long-term recovery, and facilitates independent living. Handicap International Federation, supported by the RELAB-HS Consortium and the Global Rehabilitation Alliance, calls on member states to elevate WHO's emergency functions. Rehabilitation and provision of assistive technology must be incorporated in all health emergency responses at all levels of care. Professionals must be equipped to meet early rehabilitation needs in emergencies and those of people with pre-existing disabilities or chronic health conditions. Strengthening local rehabilitation capacity requires leadership and vision. A WHA resolution on rehabilitation, encompassing rehabilitation in emergencies, will strengthen member states' efforts to improve services. Thank you.
Thank you very much. Now I would like to give floor to the Secretariat. As IOC report illustrated, regional offices play very important roles. So I will have privilege to invite two regional representatives, actually very high officials of the regional offices. Firstly, I would like to invite Dr. Richard Brennan, Regional Emergency Director, who will speak on behalf of our Regional Director, Dr. Mandali, Mandali, WHO Regional Director for the Eastern Mediterranean. Now I give floor to Dr. Brennan. Floor is yours, sir.
Thank you, Chair. Let me begin by thanking the IOAC and the Director General for their reports. Special thanks to the IOAC co-chairs, Dr. Felicity Harvey and Dr. Geeta Gupta, for their leadership, wisdom and guidance. Chair, it is hard to think of a time in history when our world was challenged by as many crises as we are today. The COVID-19 pandemic, conflict and displacement, severe weather events, accelerating food insecurity, concurrent outbreaks, and the global economic slowdown. The list seems almost endless. Most of these crises call for collective action, but even in this regard, we are challenged, as there is also a crisis of global governance. Political polarization, growing nationalism, and deliberate disinformation are undermining our resolve to tackle the world's most urgent problems. We have the knowledge, we have the resources, we have the technology to fix most of them. The only thing limiting us from bequeathing a legacy of peace and prosperity are the decisions we make as leaders. In this regard, it is striking that of the 343 recommendations from the 23 reviews of the COVID-19 response, 50% of them address leadership. This is a call for us as public health leaders as much as it is for our political leaders. The theme of this year's World Health Assembly is Health for Peace, Peace for Health. In this spirit, we should ask what we can do collectively to effectively tackle the many crises and risks facing us. As the director of a region beset by multiple conflicts and emergencies, I urge you to consider the health and well-being of the most vulnerable as your major priority. Our communities are discouraged and our frontline health workers are exhausted. They need to know that we have their best interests at heart. As per the Director General's report, some tremendous progress has been made. Far greater progress is possible if we adopt the priority recommendations from the IOAC, the IPPPR, and other reports and execute on their implementation. We owe our communities nothing less. Thank you.
Thank you very much. May I invite Dr. Lyon to respond? You have the floor.
My apologies. I was deferring to the second regional director. Sorry, let's get rid of this. Okay, I'm sure you're all looking forward to a well-earned break after this morning, so I won't delay you with my comments being too detailed. Again, thanks to Dr. Harvey and Dr. Rao Gupta for your wonderful leadership with the IOAC. Certainly have held us to account, and we appreciate your constructive criticisms and inputs to the development of the programme. And to Walid Amar, Walid, welcome on board, and we hope you'll be just as tough as Felicity and Geeta were. I will defer any comments on the situation in Ukraine. We have submitted a report on the situation in Ukraine, and this will be discussed in the following session. Just safe to say that the whole of the organisation is striving to support all people affected by the war in Ukraine, both inside and out, as we do in the over 80 graded emergencies that we responded to in the last year. The World Health Assembly's vision of delivering and improving WHO's work in emergencies to be delivered and coordinated by a new emergencies programme operating at all levels of the organisation was aimed at bringing an alignment and coherence in the work of WHO in terms of readiness, speed, agility, scale and accountability in the service of our member states and the communities that you serve. We continue to strive to do this as a programme, despite major financial, administrative, organisational and managerial impediments to achieving that and delivering on your vision. Many of you have made specific comments in relation to national emergency management capacities, the incident management system, emergency response framework. It is wonderful, quite frankly, to hear these words about all hazards approaches, community approaches, locally facing approaches, integrated approaches. I smile when I hear these words because I know that represents the way forward. I can see Ciro Ugarte smiling as well. But that local versus global, because what we've seen in the pandemic more than anywhere else is that local inequities in access to healthcare, in access to public health services, local failures of the system amplify and compound each other all the way to the top. And if we think that global solutions are going to solve what are inherent, embedded gaps in community capacity, community-based surveillance, in community agility and resilience, then we're going to go nowhere. global health security is fundamentally based on local and national health security, connected by global goods, global services, global sharing, and shared accountability for the health and welfare of the populations that we serve. Again, many of you raised the issue of attacks on healthcare. We will continue to report, to verify and report out on all attacks on healthcare, and hope that other bodies will pick up that information and data and take the necessary action for any criminal investigations that are required. Again, a number of you mentioned the prevention of sexual exploitation and abuse. We take this extremely seriously. We are striving very hard to improve our performance and do what no humanitarian should do, which is bring more harm into a world of harm that many people face in fragile, conflict-affected and vulnerable settings. We continue to support the DG's efforts and the work of the new directorate in achieving this. And Dr. Sosa and myself and the other ADGs and the regional emergency directors are fully committed to improving our performance in this regard. On the issue of people, the power of any programme, your ministries of health, your governments, your health systems, the power of our programme is its people, all the genders whom serve in this programme, and I'm proud to lead that workforce. But at the same time, we continue to remember those we have lost, and even those 2.5 years, we continue to remember the loss of Dr. Pete Salama. We thank you, our donors, for funding this programme. We thank you especially for the funding to the Contingency Fund for Emergencies. It has entirely transformed this programme's ability to be responsive to your needs and react quickly in times of crisis. I would propose finally to say that the decision to create the Emergencies Programme was a very wise one in retrospect. Even wiser was establishing that programme within the World Health Organization and retaining that, because we would like to thank as a programme our staff. You've thanked your staff, but I would like to take this moment to thank the staff in the World Health Organization, our partners who work with us in your governments all over the world, our regional emergency directors, our country leads, our country representatives, our regional directors, and the directors of other divisions across WHO who've worked with us. We are not perfect by any means, but we have worked so hard. Our staff have worked so hard to serve your needs, but we are not a finished product. We're 5-6 years into our creation. We've been in a constant process of response, and I think this is the new reality. There is no such thing anymore as preparedness and response. It's response, 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 and preparedness and response. It is a continuous circular process. Multiple emergencies we face while trying to deliver healthcare for our populations. So the ability to continue to respond while at the same time learning, preparing, changing, adapting is the new reality that we all face in the world. And that agility is something that will serve us well into the future. But I would just say that our programme is not yet sustainable. It is not yet in a position where it doesn't need the full support of our member states, the full support and constructive input from our IOAC. But again, in finality, we stand, all of us, on the shoulders of the health workforce that delivers on health care, delivers on emergency response, and we look forward to continuing to support you in future. Dr. Sosa will make some more specific remarks. Thank you.
Yes, Dr. Fall, the floor is yours.
Mike, always difficult to speak after you, so I will do it in French. It will be more original. Permettez-moi d'abord.
At the outset, allow me to thank Felicity Harvey and Mr. Gupta from the IOAC. I think their work has been absolutely vital in giving guidance to the program. The program was created in 2016, so it's a 6th birthday, and it was resolution 69-9, which lay behind the creation of the WHE, and I think without it we would be in a much more difficult situation in dealing with the pandemic. Mike and myself, and our role is to try to keep the philosophy of the program going, and one team throughout the 3 levels of the organization, a clear line of command. We need to be credible and predictable partners in responding to the needs of member states. And that's why updating the framework for health emergencies has been very important. We've had very wide-ranging consultations with the regional emergency directors. Most of them are here. And now that is ready to be published. In its new version, we've taken into account the lessons learned, and we have reflected our zero-tolerance approach towards sexual exploitation, abuse and harassment. And we've got some concrete measures on that in this version. When we do risk assessment for public health systems, we've borne in mind a risk assessment for sexual exploitation, abuse and harassment. So no request now is accepted without taking into account that risk assessment for sexual exploitation, abuse and harassment. We need to have the same framework response within countries, and we've heard that from EMRO, from Sudan, and we know that's very important. We know that Malaysia is already implementing this too. So this is a very clear framework for WHO today, and we need to take this opportunity to have this global health architecture. We need to take that opportunity to have the same thing within countries, because it's much more predictable when you have this alert system in place for emergencies. We're also going to continue to work on the basis of performance. You can't have emergency response without performance. We're a program like any other program, but we need to coordinate with other WHO programs, because when you have an emergency, other programs suffer too. And with this theme, health for peace, peace for health, at this assembly, this takes us to the very heart of this issue. We have more than 300 million people who are suffering from health emergencies. We have climate change too. Just in 2021, this was 250 million. We have more and more crises, more and more emerging challenges, including COVID-19. But we shouldn't forget old problems such as cholera. 21 countries now are suffering from a cholera epidemic. And we have a roadmap for cholera, which must be a priority. And I'm delighted to see the commitment to that. We saw that yesterday at the round table. Yellow fever, again, another challenge which is re-emerging. In 2026, we are aiming to protect 1 million more people, and we need to focus on the most vulnerable populations.
I just omitted one point, Chair. When I spoke to our workforce on the emergencies programme, as of today, 3,240 people working all over the world. Sometimes there's a misconception that all of these people are occupying bureaucratic chairs in Geneva. Just to reassure you that 17% of that workforce sits in Geneva, 565 people. The rest are in regions and in countries, representing 83% of the workforce of this programme. 24% of the total workforce of this programme works with the African Regional Office or in countries in the African region. Thank you.
Thank you, Dr. Lyon and ADG Fowl. I heard from Dr. Lyon that your workforce is working very, very hard and dedicated work. I think the committee would like to show our thanks to your workforce. Thank you very much for joining me. And then I think this committee overwhelmingly had support of the work of IOAC. So I think I would like to move to consider whether the committee is willing to take notes. So I would be more specific. Is the committee ready to note the report of the Independent Oversight and Advisory Committee for the WHO Health Emergency Program as contained in document A75/16, and to note the relevant section of the report pertaining to this discussion, WHO's work in health emergencies as contained in document A75/10 Liv 1. Are there any objections? I see no objections. Therefore, these two reports are noted. Thank you very much. Before announcing the suspension of the discussion on item 16, I have one reminder and three announcements. A reminder is just the explanation of ticket you have bought. At 2:30, when we resume, we will return to our discussion on this item, focusing on sub-item 16.3, WHO work in health emergency, when member states, as agreed, will be provided with an opportunity to make interventions on two draft resolutions contained in documents A75/A-Conf/6 and A75/A-Conf8. The roll call vote will follow. Then there will be an opportunity for member states to provide an explanation of both. So, at 2:30, we will look at two conference papers. First, each representative of co-sponsors of each resolution will speak for 4 minutes. Then floor is opened for other members delegations to speak for 3 minutes. Time is should be strictly observed. So I will enforce it. I mean it. So I have Japanese watch as well. So now this is the ticket you have bought. So please be reminded. So that's number one. Few announcements. One is I said earlier that informal discussions with regards to conference paper 7 starts from 12:30, but due to physical arrangement of the room, that will start from 1 o'clock, 13 hours, 1 o'clock. In the same room, room 24. Same room, 24. But the starting time is not 12:30, but 1 o'clock. That will continue up to 2:30. So you have arrangement was done not to make you choke by sandwich. So that is what arrangement was made. So that is one announcement. Second announcement is that before we break, I would like to inform the delegates that strategic roundtable towards a new architecture for health emergency preparedness, response, and resilience. 10 proposals for a safer world will take place at 1 o'clock, same hours, 1 o'clock, in room 26. Room 26. Roundtable is room 26. Informal discussion is room 24. So that is two announcements. My very, very last announcement, and for me it's not a good one. Bureau, myself, two chairs, and rapporteur work very well for me. And I'm very fortunate, have very competent two vice chairs. But unfortunately, Dr. Mariam Abdul Richards needs to engage herself in very important national duties on emergency purpose. So I think she will leave this conference. This is the last session. Yes. So may I thank her. Thank you. Now, I don't stand anymore between of your lunch and other engagement. So I declare the meeting is suspended. And we will meet at 2:30 sharp, and we will start. Train will start 2:30 sharp. Thank you.